My guest on this episode is Dr. Joe Vipond. Joe is an emergency physician in Calgary, and he is the co-founder of Masks for Canada and a co-chair at the Calgary Climate Hub. Now, I have to issue yet another apology, which I seem to do a lot on this show. But I have already another Canadian on the program. Already. And I couldn't even find somebody from a different city. I have another Calgarian on. So double apologies on my end. And I think that all this interaction I'm having with Albertans, it's burning up a bit of my Saskatchewanian soul. We discuss masks, airborne transmission, long COVID, what's going on in the hospitals in Canada, some of the stuff that he's had to deal with in the medical system in Alberta. And he has a very interesting point early on in the episode. And it shows his principles, and that involving this crisis that we've had for the last 13 months, that he demonstrates that he has skin in the game, and took a stance that turned out to be one where he was 100% accurate, and those that were opposed to him were dead wrong, and he faced personal cost for it. So in my personal opinion, hats off to him for that. We also get into the public policy in Canada regarding COVID over the last year, more than a year, I guess now, which I was surprised we got into so much. Not for any particular reason. I just thought because since he's a physician, that we'd get into mostly medical and scientific matters, and he would explain a lot of things to my feeble caveman brain. But I am a political dork, and so I was perfectly okay with having that exchange. And overall, we pretty much were in quite a bit of agreement on most things. Like any two sane individuals, there was a bit of a divergence on a couple things, and a couple minor issues. I don't think I really had too much agreement, but I didn't feel it was really necessary at all for us to get caught up in the weeds on those matters. And I think on the public policy issue, I feel our conversation has highlighted another issue that was really a problem well before all this, but it was, I think, perhaps highlighted through this crisis, and maybe can be addressed in the political post-mortem of what's happened. And that's that you can't look at political thought through this rigid, one-dimensional lens, or that people and ideas can just move along a single axis evenly, left to right. That's it. And you've seen all sorts of different stripes act in all sorts of different ways. Somebody of one stripe somewhere will react completely differently than somebody else of the same stripe somewhere else. Obviously, that applies to all sorts of different things, but it's really been highlighted with COVID, whereas some have tried to make this a really rigid, simplistic, sort of quote-unquote left-right issue, and it just hasn't worked out so well. And I've also seen those concerned about COVID in whichever way trying to bring in their political presuppositions to try to figure out what's going on, which also hasn't really applied for them so well. Or those trying to take a particular position on COVID, trying to make this crisis all about their own, preconceived political battle, and also just in the end doesn't end up making a whole lot of sense. And as time goes on, I'm sure I'll have more to say on that matter, as I'm still trying to formulate as to what's exactly going on there myself. And as we concluded the discussion, Joe had a wonderful personal parable that excellently highlighted how by taking action you can see results accrue from that. And it made me think of, I heard an excellent quote stated from a great Canadian on a podcast. That came out a few weeks ago, I think, but I just heard it the other day. The great Irshad Manji had a quote from Edmund Burke that was, so I'm needed to disclaim that. Not going to pretend that I thought of this on my own, but I just heard that not so long ago and definitely made the connection when Joe had his last little story at the end of our discussion here, and that is, no man makes a greater mistake than he who did nothing, because he could only do a little. So, as you think that you might not be able to do anything more about the crisis with COVID, or think that it's over, or want it to be over even though it's not, or have just given up, well, you can still make a difference. Anyway, that's all my rambling and BS for today, so thanks for putting up with me yet again, and I hope you enjoy our discussion. I certainly did. Cheers, guys. All right. Well, thanks for coming on, Joe. And I think we have a lot to discuss about what work you've been doing over the past year. But first, right now, our neck of the woods is actually getting quite a bit of press, even internationally. And there's a lot going on. So what do you take of the situation that's going on in Canada right now? And or Calgary and Alberta in particular, if you want to specify.
Yeah, I mean, I think the thing that makes us so special right at this moment is that we have all three of the novel variants, the variants of concern, circulating in the community right now in our country. Even here in Alberta, we have P1, who's just peeked over the corner. I just noticed yesterday they've announced 4 new cases of the B1135, the South African variant. And of course, there's a whole heck of a lot of B117, which seems to be everywhere now. But we're special in that we have all 3 variants circulating, and we don't know what that's going to mean. Are they going to compete against each other, and is one going to come up on top? What does that mean for morbidity and mortality? I still think we don't know very much about P1 in and of itself in a community where mitigation is being practiced and vaccines are quite prevalent, because most of the information we have on that variant is out of Brazil, where, I mean, things are falling apart. And I don't know if looking at the evidence on a variant where your healthcare system is dysfunctional really gives you a sense as to what it means for a functional system. So we're going to learn a lot over the next few weeks.
Yeah, and their government as a whole is pretty dysfunctional as well.
Yeah.
Yeah. So it's hard to say, how much of those excess death tolls are accruing as a result of just, ICUs have been overloaded for weeks now, and it's not like the data collection in Brazil is going to be the best thing that you can get in the world.
Yeah, we still don't know about vaccines with some of these too, right? Like we know there's some mismatch between the AstraZeneca vaccine and the B1135, but with the P1 variant, I did a concerted search yesterday for evidence on this, and there's one kind of letter to the editor type piece in the New England Journal of Medicine, which talks about an in vitro study taking blood from vaccinated volunteers and then applying it to in vitro lab samples and seeing if the antibodies are sticky in the lab. I have no idea what that's going to translate to on the ground, and I'm just going to keep pretending I'm not vaccinated. I got my double vaccine in January and February, so I'm considered fully vaccinated. But until I know better, I'm just going to pretend I don't have anything in my system.
How's vaccination been going for all the other healthcare workers? Pretty good.
Well, we certainly haven't gotten everybody. We still have new outbreaks coming out in our province. We had 3 announced in the last 3 days. One at the Royal Alex Hospital, one at the Rocky View, and one at the Cross Cancer Institute. So we're still getting healthcare workers getting sick from COVID. So,
yeah, you mentioned AstraZeneca and B1351. I haven't seen anything else yet with the other vaccines interacting with it. Have you?
My sense is they're pretty good match. So I know, the Moderna and Pfizer, the two earlier ones, seem to have functionality there. So
No, that's good. Um, and there's a lot of press coming out lately about hospitals out east in Ontario getting pretty hammered. Have you seen anything of the sort yet in Calgary?
it's starting to creep up, but yeah, Ontario seems to be, for whatever reason, much worse than we are at this point. We have a much higher case count per 100,000 people than they do, yet their ICUs are overflowing. And I don't know if we're just slightly earlier in the course, or if it's that our demographics a little bit younger. Um, I kind of suspect it's the former, and that the badness is just going to come as the virus kind of cycles through its process. We know that right now, like, we'll go back a couple steps. Back in November, when the second wave was hitting my province, what I did was I applied all the previous statistics on hospitalizations, ICU, and deaths to the day totals, and I think it was pretty dramatic. People thought I was fear mongering it. So, like, say there were 1,000 cases a day, I was saying, well, that's going to mean that there are 6 ICU admits from today alone, um, 10 deaths, and 35 hospital admissions. And people are like, "You're crazy. That's way too high." And then it would add them up. So the next day would be 1,200 new cases, and then I would say what that meant. And then, of course, like, after a week, you've had these incredible totals, because if you have 35 cases a day for a week, suddenly that's 240 cases. I'm not sure if my math is on. I'm trying to do this in my head as we go,
Mhm.
but the numbers added up quite quickly, and I think it really was able to demonstrate to the population that these isolated numbers suddenly are put into a context of, this is what it means for the healthcare system. At this point, I don't feel comfortable doing that, because we don't know what that in relationship between the higher hospitalization rate, the higher ICU rate, the higher mortality with the variants, versus the fact that the majority of our most vulnerable elderly population is vaccinated. So I've held off on doing that, but we know that as we have this exponential growth, I mean, geez, what was it yesterday? 1350, I think, cases a day, and growing. That even if it's quite a small percentage of hospitalizations, ICUs, and deaths, it's going to add up, and because this is exponential growth, and it's hard to fight exponential growth.
What is R in Alberta, and do you have R in Calgary in
The
particular?
R, I can bring that up. I tweeted it out earlier today. It was
Okay.
1.26 for the entire province. Sorry, I'm filling air with some hums. Um,
Hum
and
away.
for Calgary, it's 1.27.
Oh,
It's all pretty clustered. The south is good, but everywhere else it's right around 1.27. So so we have the highest R value in the country, and some of the highest cases per 100,000. And we just put in pretty middle of the road, weak restrictions, with government infighting going on at the same time, saying that even that is too much. So I have very little faith that we're going to ride through this third wave very well. I think it's going to be the worst of the waves.
yeah. Actually, from what you just said, I didn't compare all the R values of province to province yet. I've been mainly looking at here in Saskatchewan, but I'm actually surprised that it's a little bit higher in Alberta than British Columbia and Ontario right now. And then you mentioned what the Kenny government, the Alberta provincial government, has been doing as of late to contend with the issue. What have they implemented recently?
In Ontario, or sorry, Kenny's government?
Yeah, Jason Kenney's government
Yeah.
in Alberta.
The most recent thing was basically no fun activities indoors for adults. Strangely enough, nothing for kids. So my kids are still allowed to go to dance and basketball and what have you indoors,
Oh, really?
band. Um, and so that's one thing. They've limited the retail um, maximum to 15% of fire code. It was, I believe, 25% just prior to this. And no more restaurant and bar dining in building dining, which starts on Friday. I know they want to give bars, and restaurants a chance to get rid of some of their in stock inventory in their fridge and stuff like that, so things don't spoil. But boy, it's crazy to think that there's going to be another 4 days of before between the announcement of restrictions and the enactment of those restrictions. And with exponential growth, 4 days is a lot.
Hmm.
Um, there were some really good studies back in the spring that said like even a 5 day more rapid or a week more rapid implementation of restrictions would have resulted in like hundreds of thousands or tens of thousands of fewer COVID infections and the resulting repercussions of that. So time does matter. Schools are still open, uh, and yeah, and there's certainly nothing like the Ontario lockdown order. Whereas arguably, things are looking to be much worse here than they are currently in Ontario. We're just a little bit farther behind.
Yeah, just based on that rate of growth.
Hmm.
Yeah.
Yeah. I look at the variants, and it's somewhere around 600 cases of variants announced yesterday, and probably best calculation is 6 to 7 days of doubling time. So if you look at a 6 day doubling time, that means in 6 days it'll be 1,200 a day. In 12 days, it'll be 2,400 a day. And we've never had more than 1,800 cases a day in the province in the course of the pandemic. So because it takes about 10 days for restrictions to roll through to having an impact on cases per day, we're pretty much locked in, 2,000 plus per day infections. Like there's no way we can avoid it at this point, and probably higher than that because I think these restrictions are pretty weak.
Yeah, and there's so much that's different than a year ago. Like you mentioned, that the elderly are all well vaccinated, and that's going to have a huge impact. But what else is different? I feel that much of the population would have taken, their own reaction, and a lot of people would have implemented their own personal restrictions a year ago based on, what they would have felt would have been more of a unknown state, even
Hmm.
though there's so much that's unknown at the present. It's still a major problem. That there was a lot more general worry about. I may be wrong, but I feel that that's a lot less amongst the general population. So in conjunction with the less than adequate restrictions that are being brought into place, do you think that people in general are going to be less apt now to take extra precautions on their own accord, which might also have an impact along with the uh, you know, laissez-faire approach from the
Yeah, it's
government?
hard to know because in my bubble, people are still really concerned. Like, and I realize that my social media bubble, I don't get to go outdoors and talk to people anymore. But um, in the social media bubble that I exist in, people are very concerned, and a lot of people are starting to use N95s when they're going out in public, and a lot of people are pulling their kids out of school, which they um, you know indicates that they have an increasing concern. the I think part of the problem is our media and our social media tends to amplify the voices of the restriction fighters, and so they're much more visible. I was just looking at some statistics earlier today that was saying that only um, somewhere around 20 to 25% of Albertans are actually anti-restriction, and yet there's a sense that the government is kind of catering to that extreme minority of the population by refusing to put in um, hard restrictions at this point, to all of our detriment. So, I mean, I think if you look at the numbers, we have the worst number in the country as far as anti-restrictions, but it's still a very small percentage of the population. They're just super loud and have political power because we have a far right government.
There is that, people who are adamantly opposed, but but you did bring up a good point with the masks. Like a year ago, I would have known a lot of people that were concerned and taking a lot of precautions, but not wearing a mask, just because a lot of that because the messaging around masks was so thin. But now you'd have a regular person, anybody would be wearing a mask. So I guess that is considerably different. But I wasn't so much referring to the people that are really opposed, just sort of everybody in between, between those opposed and the COVID hawks like you and myself, which would constitute a considerable amount of the population, and how people might be worn out with it all, and less concerned with every action that they're taking on a day-to-day basis, and maybe that having an impact. But as I mentioned, you alluded to masks, and so that's changed so much for the positive that might make everything better on its own.
I think it's a reasonable thought experiment, but I think there's a counter thought to that as well, and that is that people will do what they're allowed to do. Like I heard on Ontario recently, Premier Ford was yelling at people for going to the malls. How can you guys be filling the malls? You're crazy. Where's your personal responsibility? Well, hey, man, the malls are open, and so why wouldn't they go to the malls? Like you've essentially indicated to them that that malls are okay to be in because they're open. Same goes for here. I heard, our chief medical officer of health saying, we've had so many events in restaurants. We got to have people start behaving when it comes to restaurants. And I'm like, well, hey, you've left them open. Like they're just doing what they're allowed to do. I make the analogy to the cookie jar. So my kids, if I leave the cookie jar out on the table filled with cookies and I walk away, and even if I don't say, you guys, maybe you should think about not having a cookie, they're probably going to have a cookie, like because they're kids. Whereas if I put the cookie jar on the top shelf and I put a lid on it and I say, look, guys, if I've counted the cookies and if I see 5 cookies now and there's 3 tomorrow, you guys are going to have a repercussion from that. Guess what? They're not going to take the cookies. And I think one of the things we've realized during this pandemic is that we as a society are rule followers. And if we're provided with a set of rules within which to work, the vast majority of the population is going to follow those rules. Masks were the perfect example of that, where in Calgary in late July, masks were not mandated, but they were recommended, and there was about 25% of the population, sorry, that was using them. And then the day after, they mandated the masks. It went up to 90%. Like people weren't afraid of the enforcement aspect of things. They were basically saying, okay, well, now that it's the law, I don't want to be the guy that's out there not wearing a mask. I'm a member of society. I'm going to follow the rules. So, these exhortations to personal responsibility have failed throughout the second wave, and then no surprise, they failed, in the run up to the third wave too. So we keep making the same mistakes over and over again.
Yeah, I completely agree with you 100% on all of that. And I would say that some of the negligence was filled in by people, but on a general basis, what should be done is what you've referred to, is that, and I think within Canadian culture for decades we've been sort of more of a not a very loud population. If there's rules in place, as you mentioned, we're generally going to follow them pretty well. It's typically not that big of an issue. And from a year ago, like what was coming out of Ottawa a lot was that general idea is like, we're not going to do anything extra, but we're going to blame the public. And now we see that with some of the provincial governments. You mentioned the Ford government in Ontario, and it's also happening quite a bit strongly with the Horgan government in British Columbia as well. It's like, we're not going to implement the restrictions that are necessary, but we're just going to push this all onto the backs of the public.
It's so embarrassing. Kenny on Monday said, "Look, guys, I really wanted you guys to follow the rules, and so I wouldn't have to do this. And look what you've made me do." It's really just an attempt to absolve them of responsibility for not governing. And I don't know how political this podcast gets, but I think it really
as much as we want it to.
I think it really has become evident that a libertarian, um, uh, bias or a libertarian paradigm doesn't work in times of crisis. So as long as everything's going hunky dory and you don't need society to act in a collective fashion, libertarianism probably is neutral, or maybe not neutral, but not damaging. But now I think it's pretty evident that it's damaging.
Yeah, I think there's going to need, after this, there's going to need to be some serious self-reflection within, the more serious libertarian camps. And this sort of idea that's going around of, and obviously it's a lot worse in the United States, of people trying to push these, what they're purporting to be these individual rights concerns to try to circumvent a collective effort to contend with the pandemic. And I've sort of seen it, derivative of this weird interpretation of traditional liberalism. And in my mind, it seemed like Thomas Paine on meth. In my mind, that's how I've sort of looked at it. And a lot of times it gets maligned as conservative, but in the traditional conservative sense, there's nothing really conservative about it. And it's a strange ethos, and it hasn't really done anybody a lot of good.
Mm-hmm. And the interesting counterpoint to that is that we have an NDP government in BC who's arguably been as bad as any of the conservative governments, and yet we have conservative governments in Atlantic Canada that arguably have been, the best, best in class when it comes to governing COVID. So it certainly doesn't fall strictly down on exactly those lines, but I think, just go through the Johnsons, the Bolsonaros, the Trumps, the Kennys, the Fords, and the Moes, and you can see definitely a trend towards badness. The Legauts, let's throw Legault in there as well as
he's done quite badly.
Hard right wing governments kind of failing outright. So I don't think that's a trend that we can ignore.
Yeah, no, absolutely. And I think, maybe a lot of it might have to do, it's really hard to say. One would have to really look at every particular factor. But, with Mo and Kenny, but then, we'd have to figure out what's going on with Horgan. But with Mo and Kenny, I think it's a change that's happened with right-wing politics in Canada, where, they're derivative of, old reform, and that sort of political movement, where you might have a lot of the red Toryism that's still present out east with, say, the King government in Prince Edward Island. It's that sort of, not really so much conservative, but hardline neoliberal ideology that might go more so with Mo and Kenny. That might be an explanation for their actions. But then as well, too, you see it with social democrats, whether it's the government in Sweden or the government in Victoria, that are also completely negligent, extremely so in Sweden. So
I think one of the, and I don't mean to wax too philosophically, but I think one of the hardest things for me, Joshua, through this pandemic has been the realization that our society is not as strong as we wanted it to be. The sad realization that we've made so many mistakes when it comes to policy, that the leaders that we hoped we'd have, even within the field of medicine, have not led well, and that this trend towards individuality over collective action since the end of the Second World War has taken us to a point where we were kind of predestined to fail in a lot of ways. And my background is in climate advocacy, and so I, despite the horrors of the pandemic, I still have not lost my fear of what's going to come down the pipe as the climate continues to be disrupted. And so, for me, it's that reflection on um, what that means going forward for climate action. But then on the plus side, we do have, the New Zealands, the Taiwans, the Japans, the even the right wing government in Australia somehow managed to pull it off. Atlantic Canada, there are these shining lights of how it can be done right, um, that do give me some hope, on both fronts. So
Yeah, well, I think it's going to take a long time to sort of, you know, parse through what's happened and what needs to be resolved. And it's pretty complex. But I think we should maybe accommodate our uh, foreign audience, which will probably
okay,
be
sure.
the majority. Sort of run over how you've seen things have gone in Canada on the policy front over the last year, and also feel free to pick out, any particular provincial government and what's been going on there. And for anybody outside of Canada who's not, too familiar with our government structure, we are, a federation. Our provinces don't have quite as much power as the states, but it's extremely comparable. Same with the Australians.
Well, it's been a fascinating journey. I'll tell you that, Joshua. And maybe I'll just talk. Would it be reasonable to just talk a little bit about my history through the pandemic, and then we can maybe
Oh,
pick out some
please.
of the
Yeah,
history there? So,
sure.
I mean, I think back around May 5th or March 15th last year, things were starting to hit the fan, and I started to realize that as an emergency physician, that I better get to know this virus pretty well because I'm going to be dealing with it. And I think because I've always had a dabbling in public policy and a dabbling in advocacy, I maybe took it as a different lens than some of my colleagues. And so the first thing that I think I just, like maybe some of my colleagues, just started reading a lot. Um, and my family had moved into my in-laws. Unfortunately, my in-laws were 5 doors down from me, just because we saw what was going on in New York City, and the healthcare workers in New York City were being decimated by the virus. And it's like, it's okay if I get the virus, but I'm not giving it to you guys. And so we sent them 5 doors down, and I got to hang out with them outdoors every once in a while. But I mean, I had a lot of free time. When you have kids and suddenly you don't have kids, suddenly you have a lot more time to yourself. So I did a lot of reading. And the first thing that I recognized was that there was asymptomatic spread, and we needed to manage that. And the second thing was that we needed to wear masks. Um, Now, locally, we had our local ID people who basically were saying out loud in public that there was no asymptomatic spread and there was no nosocomial or in hospital spread. And therefore, we didn't need to wear masks. And so I started wearing a mask at work, and I started asking our leadership to basically enforce a mandatory universal masking in the emerge. And I got in trouble. I actually was disciplined. I had 10 days to go think about what
Sorry
I'd
to
done
cut you off. Why?
because I was just a frontline emerge doc, and I was out of my lane, and I was disrupting the hierarchy. So, so during that 10-day period, that gave me even more time where I'm not working, I'm not hanging around with kids, um, and basically I had the time to even think more about what was going on, and so it was pretty clear I was not able to advocate within the hospital system anymore because that I somehow burned that bridge. Um, but then I thought, well, maybe we should start looking at masking. Like, if this is going to be important for in the hospital, it's probably going to be important everywhere. So we should start doing masks. And I don't know if you recall at that time, Joshua, but um, the line from the powers that be, from Theresa Tam and our public health officers, is masks were dangerous. We shouldn't be wearing masks. Um, you should only wear a mask if you're symptomatic. So that means if you had a cough or a runny nose. But at the same time, the other messaging was, if you had a cough or a runny nose, you should be staying at home in your basement. You should not be going out in public. So it was a bit of a weird messaging. Only wear a mask if you're symptomatic, but if you're symptomatic, you don't have to wear a mask because you're going to be staying at home anyways.
It was actually
Um,
worse than that. Teresa Tam was she elaborated quite a bit and was even worse than Anthony Fauci on this. She went into detail about basically how the population were going to be too inept to really wear a mask, and oh well, we're just going to be touching our face all the time, et cetera, et cetera, et
yeah,
cetera.
there was.
You're not going to be able to use it. Well, if you spend as much time going through, talking to us like we're 9-year-olds, wash your hands, wash your hands, wash your hands, and spent that same amount of time, money, and resources on public messaging on mask use. Well, you might have quite a number of Canadian mask wearing gurus in the population. But yeah, anyway, yeah, I
Yeah.
recall that nonsense.
So we wrote an op-ed. We were the first public exhortation to allow masking, and that I think was April 7th. And then we were allowed to wear masks, thankfully. The CDC first allowed it, and then PHAC quickly followed after that. And then we moved on to saying, well, now it needs to be mandatory. And by this time, I'd been in the media a lot and I was tweeting a lot about this. And there was a gathering of people that were kind of thinking the same way. And so at one point, we're like, hey, we need to get together and start to work on stuff. So we formed something called Mask for Canada, and which is still going strong. Grassroots group of people, some physicians, but also I think we have a dental hygienist, and we have some occupational hygiene people, and we have professors of literature. It's a quite wide swath of civil society, and then we started to work together. And I I think one of the things that became evident is that power of organization, the ability to like bounce ideas off of each other. Oh, that's a great idea. Oh, what are you thinking there? That's not a good idea. And then we started working on mask mandates across the country. We started putting maps together of where places where masks were mandated. When the schools finally opened up, we started collecting data on where the schools were having cases. And we have a map up there about where schools were. And then, of course, when the second wave started to build, it was through that organization that we started to push forth our efforts on getting restrictions in place when our various governments were refusing to do so. And so we wrote open letters, and we met with politicians, and met with our chief medical officer of health a few times, and we just did not stop. Um, and Yeah, and more recently, what we've been focusing on, well, obviously through the third wave, we're trying to get restrictions put in place again. But the other thing that's been a really interesting fight over the last few years, or sorry, a few months, has been airborne transmission. Because we've known pretty early on in the pandemic that airborne transmission is a big factor in COVID mitigation strategies. There's just different strategies you put in place if this is contact droplet, like we've been told for so long, than if it's airborne. And those things which you probably heard a bunch about is ventilation, better masking, tight fitting masks, and the need for, if you're in prolonged indoor spaces, that distancing does make a difference. So if you're in any indoor space for a prolonged period, it's not that you have to not wear a mask if you're 2 meters apart. You just have to wear a mask all the time. And so that's been an interesting evolution as the CDC is finally starting to get more vocal on that. The biggest resistance is the WHO, but even this week, when the new restrictions were put out by the Kenny government, I saw the words, because this is a droplet spread disease, and so we still have not won this battle.
Yeah, no, and I think it's going to take quite a while yet. Yeah, I think if you get people on board with proper mask use and wearing proper masks and proper mask use, then in doing so you can kind of, in a way circumvent getting all the full messaging out about airborne transmission, because there's so much pushback from that, and it's going to take seemingly quite a while. Maybe I'm wrong. Maybe it can turn on a dime
We have
to
an event tomorrow, which I'm very excited about. Which tomorrow, this will be. I'm sure this podcast will be dropped after tomorrow, but I'm sure there'll be a recording where people can find it. Where the director of policy, one of the chief policy advisors for the WHO, is going to be advocating against airborne transmission against two of my favorite COVID people, David Fisman, U of T, infectious disease specialist, and Kim Prather, who's an aerosol engineer at the University of Southern California. And it's going to be a fascinating discussion, and we really hope that it will relaunch the effort to get this recognized as an airborne disease.
Absolutely. And in the preceding episode on this program was with Jose Luis Jimenez from University of Colorado Boulder. So if anybody is just popping to this program now, and I have a whole episode just on this topic preceding this one that you can check out. And yeah, all three mentioned
He's amazing.
Have been doing brilliant, important work on this very significant issue.
Yeah, I think it's so important for us to understand the basis of transmission for this, because if we get it wrong, then we get all the mitigation strategies wrong. Like, it's like saying, climate change is real, but it's not from humans. Well, if you make that initial mistake, then you're never going to fix climate change, because you're going to be trying to, I don't know, put corks in volcanoes or something like that. Whereas that once you know that it's human caused, then you can actually manage that. So it's really important that we understand these fundamentals.
Yes, no, I absolutely agree. It's just been quite the not even just the difficult, but the odd uphill battle over the past year in dealing with that.
Yeah, I think there's a bunch of reasons for that. You probably went over this with Dr. Jimenez, but there's more significant cost that goes into dealing with this as an airborne disease. You have to go into buildings, you have to measure ventilation rates, you have to improve ventilation if they're not up to snuff, you have to do better distancing, the masks need to be upgraded. And you've probably seen those little plastic masks that sit on people's chins and kind of sit off their faces.
Oh my God. I can't believe they're real.
It's not working.
Well, I seen one of those in Costco, and I couldn't believe it was a thing.
Yeah. So, it does change the way you have to approach this. But I think and you've probably seen this, Joshua, this idea that all we got to do is get through this vaccination phase and we're free, and therefore we don't have to put any long-term, expensive mitigation processes in place. And I think we're seeing with this third wave is that we can't ignore all the other stuff, that immunization isn't a panacea. It's not going to fix everything. Even when everybody or 80% of the population is vaccinated, we're probably still going to need some of these non-pharmacological interventions in order to keep things down. And with the variants, it's there's always that fear that we're going to be dealing with variant waves going forward. So we might as well get this right now, rather than saying, well, I don't want to do anything hard because, we have technology that's going to save us shortly. It's kind of like climate change.
Yeah. Yeah. Do you think that a lot of it, why so many policymakers are so apprehensive with really bringing the hammer down and getting this dealt with at this moment, is that they might lose some capital by demonstrating that they've been doing it wrong for a year?
Yeah, that's an interesting question.
From the most cynical avenues of my brain.
Yeah, I think even people have told me, you probably had somebody on with COVID zero discussion before, Joshua?
Yeah.
Yeah, so just going to the COVID zero, like some people have told me, like, there's no way that Kenny can eat up all of his political capital on chasing a COVID zero strategy. And I'm like, what do you mean? Like the most popular premiers in the country are in the Atlantic provinces. Jacinda Ardern is probably the most popular leader in the world right now, for at least in the Western world, for what she's done. And this is a winning political strategy, um, but you got to be a leader, and you've got to be. You got to be willing to do the marshmallow test, and I'm sure you've had people talk about the marshmallow test. That idea that the Stanford experiment, where a kid who's 3 years old has a marshmallow on the table, and you say, if you can wait 10 minutes, I'm going to give you a second marshmallow. And then the researcher walks out of the room, and only about 30% of the kids can hold off on grabbing that marshmallow. And so we collectively, in much of North America and Europe have failed our marshmallow test, because we can't go through that extra 7 weeks of restrictions to get the numbers down, and we can't contemplate closing our borders to interprovincial travel. And it's unfortunate, because I think politically it's actually the way to become popular. What's worked now for Kenny he's got the lowest popularity in the country, and
I think for reasons that I haven't been able to figure out yet, there's going to be, and it's not like they're the most wealthy province, and there's long term issues, but the because McNeil resigned at some point, but whoever the new premier is in Nova Scotia, he's actually somehow below Kenny for reasons I haven't been able to figure out. But yeah, Kenny's
time will tell.
Yeah, he's not doing so well. But no, yeah, no, you're absolutely right there.
Sometimes leaders have to lead.
Yeah. And so back to what I was getting at before, how just outline for everybody, and also just not just a cold sterile recollection of events, but what have you seen happen in the country over the last year as far as policy and how that's progressed, and anything in particular you found interesting in any particular provinces. And we've already mentioned that the three western provinces have really done some really dumb things, and the four eastern provinces have done a lot of really great things.
Yeah, I mean, it has been. I think what I think has been the hardest thing, and maybe this is just from my perspective as an advocate, is that every progressive action, everything that's been good, has had to be fought for. Um, and I wouldn't have expected that. Like, I would have just expected that some of these things would have just been naturally taken on. And so when I'm talking about stuff like this, I'm talking about like recognizing that racialized communities are the highest at risk for COVID and mortality, because of the nature of their work predominantly and their living spaces. The meat packing plant debacles, multiple debacles, serial debacles in Alberta and elsewhere in Canada and the United States. Quite shocking that we're not able to recognize those things and mitigate that. The masks, the fighting for restrictions, the attempts to convince leaders that anticipating problems rather than reacting to them is the best way forward. I initiated the hashtag preventable and predictable wave for this third wave, because by this third wave, we should have been able to see that we know how to deal with this, right? Like, we'd gone through two previous waves here. We'd seen other waves go around the world, and we know that government imposed restrictions are really the only way of successfully managing an exponential curve. And along with that, COVID zero is the only successful long-term strategy. And yet we have been unable to convince our governments to anticipate and act early and to do COVID zero. So I think from a policy perspective, it's just always been a fight. And I think I was pretty naive and I was like, hey, we won the mask battle. Yay, I can relax now. And there's never been a relaxing. If anything, I'm having to fight harder now than at any point in the pandemic. And it's quite frankly quite exhausting.
Yeah, and what do you think has caused the federal government to stand back so much? Like there was a talk early, I believe, April, pretty much exactly a year ago now. I think when Justin Trudeau met with all the premiers, and they unanimously said that the Emergencies Act shouldn't be implemented. And for anybody listening doesn't know what that is, it used to be called the War Measures Act and was implemented once during the FLQ crisis by our Prime Minister's father. And what that does is it allows the federal government to supersede some of the provincial powers. And so, why do you think that all of the premiers were opposed to this and still are? There was another discussion very recently again between Ottawa and the provinces, and it was shut down again. So why do you think the premiers, all of them, are so opposed to this, and why Justin Trudeau hasn't been pushing harder for this or just implemented it anyway,
Yeah,
considering that his popularity hasn't really gone down as well too?
yeah, it just shows the challenges of our style of federalism, and that everything is political, right? I mean, it's all about power. So arguably, you could say, why does a 40-year-old um, Filipino woman in Northeast Calgary deserve to have less protection from a deadly virus than a 40-year-old Filipino woman in Halifax? Um, and uh, as a Canadian citizen with the federal government, we should be deserving of the same level of protection. I think you can make that ethical, moral, and maybe even political argument. Um, but at this, but Justin Trudeau is unwilling to step on the toes of 10 premiers and three territorial leaders. So and that's a political choice that he's made. And as we have continued to have half measures here in Alberta, and I see this exponential curve, and I look on the horizon to incredible suffering from hospitalizations, deaths, and long COVID here in my province. And I think why not have a federal standard for policy um, within the country? But maybe, I mean, we've talked a little bit about my interest in climate policy. There has been a lot of political capital expended on having a federal um, approach that supersedes provincial powers on climate. And so maybe two existential crises for one federal government to deal with at once is a bridge too far.
Yeah, or maybe, and as well too, like there's going to be um, uh, energy sector reform and all sorts of changes going on there for years and decades to come. So, maybe in the eyes of some politicians that this is a months or year long thing and just ride it out and move on to the next issue after that was, perhaps their thought.
Eventually, the bodies will slow down and we won't have to bury as many, right? So eventually, this will become less of a story. They're just they're just people.
Yeah, it's been a brutal year.
Yeah, yeah.
You mentioned long COVID there. What like as you're an emergency MD? Have you had any firsthand experience having to contend with that with any patients?
Yeah, I've had a couple. I have one colleague who did get unwell, and I've heard through other colleagues that that person has had to take time off and shift their schedule in order to deal with the fatigue that has followed the illness. I also had interestingly enough, a neighbor that I saw as a patient um, uh, in the emerge who had intractable vertigo, came in with like this sudden bam, like unable to, world spinning, having to lie in bed because of the intractable vertigo and the nausea that came from it. And I know that things are getting a little bit better, but I know that it's been weeks of symptoms. Um, and so those are my two, personal experiences with long COVID. But the more we learn about this, the more terrifying it is. Like just yesterday, the report on mental health and the exacerbations of mental health. We also just recently saw that erectile dysfunction is what 8 times higher in long COVID sufferers than non-long COVID sufferers. Um, and then that's on top of the stuff we already knew, which was fatigue and cognitive dysfunction and chronic chest pain and chronic shortness of breath. And I don't know if your listeners are up on this stuff, but it seems to be irrespective of age. So about 10% of kids are getting this, and it's also irrespective of the severity of the initial illness. So you can even have a very mild form of COVID to start with, and still be at risk of having long COVID. And it's affecting 10 to 30%. So remember, I was saying that in November I felt comfortable predicting the daily numbers and how that would roll out to those acute impacts. Well, I feel pretty comfortable now that we can easily say that with yesterday's 1,300 numbers in Alberta, that's going to translate to about 130 to 390 Albertans with a long-term disability. Um, and so that's really sobering from one day's cases.
Yeah, that is a big number. And one thing I've been wanting to ask a physician for a while, what the hell is COVID toes?
So I've seen it once. The traditional description of it is in pediatrics that kids were getting this. That it was happening quite late, so people would um, to be testing negative for it, but there was evidence that they had gotten COVID earlier. And it seems to be like a microvascular problem, and that there's these little clots. We know that COVID, um, one of the sequelae of that post-acute infection is thrombotic events, so clotting. And so it looks like these are little clotting events that happen and cause your toes to kind of go a purpley red color in splotches. Um, I've only seen it the one time. I saw it back in April, and I haven't seen it since. And I haven't heard any recent descriptions on it, but that's as much as I can tell you.
Okay. Yeah, that one's always just I haven't been able to understand, and it seems to really stand out from the rest of the long-term chronic symptoms that people are having to face.
Yeah, I don't think it's a long-term thing. I think it
Oh, okay.
goes, and I don't even think it's painful. I think it's just, oh my God, what's wrong with my toes? They look all purple.
Oh,
Um, but I'm not an expert on this, so I could have aspects of that wrong. But I think what this has really been fascinating for physicians is how many different ways this presents. Right? Like, can you think of any other, maybe even virus, or never mind any other illness, where like the acute presentation can be asymptomatic, or a sore throat, or pneumonia, or diarrhea? Like, it's it's such a huge spectrum, or just like weakness or confusion in some of the older patients.
yeah. Does
um,
like maybe early HIV, like when somebody gets infected, have a wide variety like that?
well, actually, HIV is, I guess, in some ways similar in that in the late infection of HIV, you just have all sorts of weird infections, and they're very atypical infections. So you were seeing atypical pneumonias, and you were seeing some weird cancers that were associated with it, and brain infections, and so it could present in all sorts of multitude of ways. But those were all kind of secondary um, diseases associated with HIV that were kind of brought out by HIV. Whereas this is the virus itself. It just has so many sneaky little ways of doing things. And then the long term on top of that, so they have increased clotting. So people are dying late because they have, clots in the lungs, and then all the other long term aspects of things from the long COVID. Like it'd be hard. Like if you were like writing um, a pandemic story, like there's no way that you could convince any of your readers that any of this could be true. It's a classic truth is stranger than fiction type of scenario.
Yeah, I have found, like, for the whole year, what been happening to people, just that range of symptoms, just absolutely bizarre. And a question just popped in my head, as somebody who's not a scientist, and just essentially your average person. One thing that I haven't seen really covered a lot is when somebody has very severe acute symptoms and are at severe risk of death, or who happen to reach their demise. What is actually what are the symptoms that people in that critical condition, what are they experiencing, and what actually happens to them that can cause a fatality?
Well, the thing is there's so many different ways that they do that. The classic one is just the pneumonia. They get this thing called pneumonitis. It's like an inflammation of the lungs, which seems to be a combination of the the virus itself and the body's attempt to deal with the virus. Um, and so the classic way of dying is then your lungs just crap out, and then you get multi-system organ failure. So your liver shuts down, your kidneys shut down, your heart's not working very well, and then you pass away. I'm hearing more of people being put on ECMO, and I'm not sure if you or your listeners know what ECMO is, but it
Well,
stands
I
for
sure as hell don't. So,
yeah, extracorporeal membrane oxygenation. And so basically, this is what we euphemistically call a heart and lung machine, developed so that people can actually do surgery on the heart. So it was initially developed so that if somebody needed some intracardiac surgery, you could essentially disconnect the plumbing from the heart and the lungs, and continue to pump oxygenated blood through a body while a surgeon is working on a heart that's not beating. And then they rehook everything and let the heart go. But it kind of evolved into an intensive care unit tool where if your heart and lungs were completely failing, you could take someone. Basically, they're dying or they're dead. You could take them off that circuit and then keep them alive by using this heart and lung machine for a period of time, while hoping that their heart and lungs would heal during that period. And we're seeing this being used a lot more in the last few months because our ICU patient population is getting younger than it was in the first or the second wave. And there's a bit of a desperation in our ICU doctors to keep people who have otherwise preventable deaths from dying. Um, I don't know if I've read how successful it being. Like, I don't know what percentage of people on ECMO are surviving ECMO, and how many are dying, but I'm hearing about it a lot more.
yeah, anecdotally, you're seeing some positive results from that.
I'm not an ICU doc, and I'm not in any discussions where I know what the outcomes are. I'm just hearing in news reports and
Oh,
in
I
in
see.
chat discussions that ECMO is being used a lot more. That a lot of the people in the ICU are on ECMO.
So you mentioned that you're seeing a lot more young people entering the ICU. What's going on there?
Well, we've protected vaccines work. So the elder population, which are the most susceptible to the death from COVID, have been vaccinated early on in the disease. And on top of that, there seems to be in all three of the variants that are circulating in Canada, that these three variants have worse outcomes in younger people. So more likelihood of having severe disease at a younger age. So I think it's the combination of those two things.
Great.
Yeah.
Uh, um, Now, from your work as a physician, at what point, like as you mentioned before, like it's looking like the worst point could be next week or the week after that or the week after that or something like
Or
that.
the week after that,
Right,
depending
right,
on how soon
exactly.
we act.
Right, exactly.
I think
Yeah,
Ontario's finally done it, so Ontario's okay. But and I'm not sure where you guys are at in Saskatchewan. But yeah, BC and Alberta were in trouble.
Saskatchewan's weird, and I think you might have seen this, but ours gone down in Regina, but it was between 85 and 90% of the new variant cases were all accumulated in Regina, and a lot more in the southern part of the province. And then earlier on, it was a lot more dispersed. You had a little bit more in Saskatoon area, Prince Albert area, the north, but all the variant cases were in Regina. Ours gone down there now, Regina, and it's going up in Saskatoon. But everything is all in Regina, and they shut a lot of other stuff down. So there hasn't been too much overwhelming of hospitals or anything. But we're still not in a good state in Saskatchewan, but things are definitely worse
Just
now.
looking at the numbers right now, and Regina does have the honor of being the worst cases per 100,000 of all the cities that I see on here. I don't see the Ontario
I think
cities.
that includes the United States too, just
Oh,
not
really? Wow.
Mexico. Yeah, I think Regina has more cases in ratio to the population than anywhere in the United States or
Quebec City's
Canada.
nipping at your heels, though.
Oh, geez, that's
And the,
yeah.
the other fascinating place, which I think it's worthwhile mentioning from hey, what are they doing right perspective, is Manitoba. And the only thing I can think of there is that they actually put in interprovincial travel restrictions there,
That was a big
unlike
one.
the other COVID-6. And so if you want to travel into Manitoba, you have to quarantine for 2 weeks. And whereas if I want to go to BC, I can just cross the border tomorrow and then pick up P1 and come back the next day. And either way over that border, there's no restrictions at all. And I think that's been a real policy miss. I think that's been the probably the main reason why the Atlantic provinces are doing so well. One of the reasons, and one of the reasons why the other five of the COVID-6 provinces are doing so horribly.
Yeah. The one other thing they did well, and as of late, I've been pushing back a bit harder against the COVID-6 because I think Manitoba's much been more an in between. And even though there's tons of room for improvement, I think at this point in time we got to give certain places credit where credit's
Mm-hmm.
due. The Manitoba is sort of this weird in between, as I've sort of seen it throughout 2021. But the other thing I think
Look, we
is
can learn.
yeah, exactly. We're adapting, but I think the one is they haven't fucked around with enforcement. It's been pretty big in Manitoba, and I think that got things under control a lot. They is not just the provincial government, but I think the city government, Winnipeg too, made it pretty clearly on that we're not screwing around. We're going to have these restrictions, and if you don't care about them, then there consequences may be coming your way. But yeah, those interprovincial border restrictions definitely would have made a big thing. And what I'm surprised when they implemented them, what was that, in January, that that didn't catch on into people's minds a bit more across the country.
But you remember that Oregon was contemplating it and then quickly
Okay.
dismissed it. I think that was maybe in November or December. Um, and I think he actually said the words, "Well, we can't. There's no way we can actually um, legally do this." But obviously, you can, because 5 out of the 10 provinces have successfully done that. And when everybody challenges this to me, when it comes to me talking about this about Alberta, it's like, well, I'm not saying it's going to be easy, but just because it's not easy doesn't mean it's not necessary and not possible. I mean, we have lots of people out of work here. Give them a highway vest and put them on a roadblock at the border and turn people back. And this is a possibility. We are in a pandemic. This idea that we can't inconvenience people because they need to. The status quo must live on, I think is naive at best, and we're seeing that. Can you imagine how much better? I mean, I'm probably one of the main reasons why Manitoba is doing so well is because it doesn't have variants there, and so the only way of preventing variants from getting into a place is by having travel restrictions, and unfortunately,
I think they have one.
yeah.
Well, I'm not sure, but it's not like the other three to the west of them,
Hmm.
and they've done a lot more to stamp it down. And as well too, like the whole idea that, oh, we can't implement a border restriction, it's sort of hand waving. It's just like, oh well, we're not going to do it, we can't, so
Hmm.
just forget about it. Like what's the difference between there's less crossings at the BC Alberta border than there is at the Saskatchewan Manitoba border, and
Hmm.
that one's shut down. And with the border between our two provinces, like we it'd be the same thing. We just have to figure out what to do with Lloydminster. And
And can we just talk about racism for a couple seconds, because this whole travel restriction thing was perfected in East Asia, along with masking, along with other you know interventions in East Asia way back at the beginning of the pandemic, and successfully and ongoing successfully. And I have friends who live in East Asia, and they say, if someone's going to come visit me, they land at the airport. They are shuttled onto a bus after going through border control. There's no way of getting off of that bus. That's basically you're put down a corridor with no doors on it, and you get on the bus, and then you're put into a hotel room for 2 weeks. And if you leave that hotel room, you get like a $10,000 fine. And that's, I think, to a lot of Canadians, that sounds extreme, but people just accept that if I want to go to China, or if I want to go to South Korea, that's going to be the repercussion. That's going to be the consequence of wanting to do that trip. And so I better really want to do that trip in order to suffer through that. And similar, maybe not quite as extreme, but similar actions exist if I were to want to go to Newfoundland, for example. And I do think that there's been an element of this. Well, South Korea is not Canada; they're different from us, and therefore we can't do the same things. And I think that's been belied by some of the successes, which I don't know how many times I can one podcast go back to extolling the virtues of Atlantic Canada's policies, but I think you can see that we can do that as a society if we decide that it's important enough.
yeah, no, I think so. And as I sort of mentioned before, like I think, and maybe things have changed a lot more than I think they do, but I feel like in Canada there's more. I don't think it's too hard to get everybody to follow along, and it wouldn't be that hard. And I think some have just sort of hand waved it away by just saying, well, we can't do it. And then it all comes down to policy failure. I think if these things just would have been implemented, it wouldn't have been the end of the world. It wouldn't have caused that big of an uproar, and
Mhm.
it would have worked out fine. I think we're absolutely capable of doing it.
And I think you kind of mentioned it earlier in the podcast, where it's like, and now if they start doing that stuff, they're admitting that everything they've done up to this point is wrong, and that's hard for people to do. It's like the WHO admitting that COVID is airborne. Oh, so you mean for the last 14 months we've been, working under the wrong framework, and it's our fault that 196 countries have been working under the wrong framework? That's a hard thing to admit, especially when people are dying because of those decisions. And so you can see why there's a resistance to back down on admitting some of those failures.
Yeah, on the airborne one, in which I didn't know until I spoke with Dr. Jimenez, that issue of a certain bit of scientific dogmatism is really ingrained, which I didn't know about before. And so that particular issue, the rabbit hole goes really, really deep
Hmm.
from what I've been told. But even if it does get out, like I think health agencies are a little bit more apt to make changes than politicians are, because they don't have to go to the electorate at some point in time and admit that they had this huge thing wrong. I think some of them might be able to, if they turn around soon enough, they might not be able to worry about it. Like Boris Johnson in Britain, he had his policy was rather uniform to Sweden. Let's go for herd immunity, and that only lasted a couple weeks or so, and then he turned around to sort of a middle of the road mitigation sort of strategy. But and as well too, like Tam was against masks, and then by September she's telling people that they should be wearing masks while they're going for a romp in the hay. So
I think politicians are afraid of admitting that they're wrong, but I think the electorate is very forgiving of a politician that actually honestly says that they're wrong. You look at this may be getting too much into the history of Alberta politics, but we had a premier here called Premier Ralph Klein, who was kind of loved. He was a bit of a jerk, and he was a bit of a libertarian a wingnut and hard right conservative. But he would get drunk and throw money at homeless people, which would sink most politicians, right? Like that would just be the end of them. And then the next day to go, oh man, like I have a drinking problem and I made a big mistake yesterday and I can be better. And our current premier has no ability to say, oh yeah, that was a mistake and I can do better. I will do better for you. And I think that's part of the reason why he is not as popular as he is that he could be, is because he has that inability to admit to mistakes and to say, I can do better than what I've done. It's probably a fault that's not unique to him when it comes to politicians. I think that's probably pretty standard amongst people who try for positions of power.
Yeah, there hasn't been very much of that sort of humility going around within the political sphere in Canada the last year.
No.
Sort of, we really got it wrong, but we're going to try this instead now, and it's really, really unfortunate.
Yeah, agreed.
You at what point so far have you seen where we've had the worst hospital overloading? Would that have been in the first wave, or the second wave just after Christmas, or even where things are right now, even though they're definitely going to get worse? Not how they're probably going to go next week up until today.
We are not at our worst. Our worst was in the second wave, and it's hard to know exactly what's coming down the pipe as far as hospitalizations and ICU go in our province. I think Ontario has officially superseded any record for the pandemic in the last week, and it looks like things are really falling apart there, and hence the stay-at-home order that was initiated this morning, or was it yesterday? But here it's been a lot slower, and I think lulling our politicians into a sense of well, maybe it won't be so bad this time. Unfortunately, especially exponential math, hope is not a particularly good strategy, and so I anticipate that things will get worse, and we're just farther behind the curve than Ontario is.
So in the last wave, just following Christmas, what were the highest amounts of ICU bed occupation that was going on in Alberta?
I'll have to look at my statistics, which will take me 2 seconds. They're pretty much up all the time.
Got them nice and handy.
Of course, I say that and then I can't find it. I hope you can edit.
Oh no! Well, just sing us a song.
It's an option. Yeah, we have this. I think one of the best parts about the pandemic for me, this is my segue music, is some of the journalists that have stepped up to fill the gaps in our reporting. Like I think we've all been kind of feeling sad about some of our institutions, and the media institution, of course, has been decimated by the on the arrival of the internet and free news on Facebook. But there's just been some exceptional journalists that have stepped up. And one of them in Alberta has been Robson Fletcher, who's been doing all of our statistics. And so whenever I need information on COVID statistics, I turn to his page. So our highest day was about 150, 149 for ICU, and at the moment we're at 79. So we're about half that. Um, and what's been really interesting in this wave is I see the ICU rates going up quite a bit faster than the hospitalization rates. Whereas the last wave, there was quite a huge ratio of hospitalizations to ICU, about 6 to 1. Now it's about 3 to 1. Let's see, to 80 to 250. So yeah, maybe about 3.5 to 1. So quite a bit more ICU. I think that may be indicating to us that the variants are much more pathological than or virulent than the original strain. And I think it may also be that in the first wave, a lot of the people that got really sick were in the elderly population. And because they were in long-term care and maybe had some issues like dementia, or were maybe in their 90s and they just decided they didn't want to go through the pain and suffering of a hospitalization, they had been made a comfort level of care, and therefore more apt to end up on the wards or just pass away at their home or institution rather than come into the hospital at all. So it's probably a combination of that that's causing our ICU ratio to be much higher than the hospital ratio.
And at what point will it hit the wall?
So it's hard to know exactly with this battle between variants and vaccines, how this is going to play out. It's much less predictable than in the first wave or second wave, where we could literally say, like in the past, the this 3.7% of cases would end up in the hospital. That actually ended up being 4.5, so quite a bit bigger, but I was using 3.7. And that was very predictable. And I just don't think it's as easy to predict this time.
Oh, okay.
It's going to be going up. As long as the exponential growth is going, we will have increase in our hospitalizations in ICU. It's the steepness of the curve that I think is less easy to predict.
And how close were you to the hospitals just being overwhelmed from the last wave?
I think it was pretty close. Our at our peak, we had 755 inpatients, and one of the things that people need to know is that over the last 40 years, we've closed a lot of inpatient beds, so our capacity is much smaller. We've kind of started to run it like a just-in-time inventory thing. The idea is that your hospital system is the most efficient if there's never any empty beds, and that works maybe for just-in-time inventorying for an auto factory, but for things like airplanes that need to land at airports, you can't have just-in-time delivery. You always need to have a bit of space there, and the same goes for hospitals. And so we've decreased the capacity for our hospitals to absorb that. So yeah, 755, 765 at its peak, and ICU kind of around 150. And right now we're at 80 and 254. So
I watched I can't remember which channel it was or whatever, but there was a report coming out of Ontario that from this one hospital where they were they couldn't even use a lot of their beds. And a lot couldn't be attended to because so many nurses have quit because they've just had enough. They just can't deal with it. Have you seen much of that in Alberta?
No, my field of view is very limited to one emergency room and one hospital, so I don't have that bigger picture. I can tell you that a lot of physicians have left the province simply because of the bullying of our Minister of Health and of the healthcare the government. There's been multiple people who've left say like I just can't deal with this, especially family doctors, where they cut the amount of money that they were able to earn in order to try and decrease the spending in the health budget. Um,
Hooray, austerity.
yeah, and this is disproportionately affected the rural areas where, if you only have three doctors there and one leaves, that's a huge difference. Whereas in a big city, you lose 10 family doctors, it's not as evident an impact. Um, but I tell you, I'm tired. And the government is now asking us again to, as emergency doctors, to step up and provide services on the COVID wards, because they're expecting this surge of COVID patients, and certain emerge docs have volunteered to be a part of that. And I'm sure there's doctors out there that are going, well, wait a minute, this was a completely predictable and preventable wave. Everybody I'm going to be seeing in the hospital is there needlessly due to your policies. And why should I be expected as a physician to clean up after your mistakes? Um, I'm just kind of supposing. I'm not in any of my colleagues' brains, but there's got to be an aspect of that that's going through people's minds.
So when they're leaving, where are they going?
Uh, uh, there are other provinces that are quite happy to take our physicians. I even heard, I
Yeah.
can't remember which province, but one of the provinces was advertising in one of the like medical specific venues, say, don't like it in Alberta, come join us. I think it may have been Ontario, but I'm just guessing there.
Gotcha. Oh, that plan is really backfiring on them too.
Hmm. Yeah.
Geez. So what? Uh, I guess we've talked about it a lot as to where we're going forward, and things aren't looking. Some things aren't looking great, and a lot of things are just uncharted territory, and we don't know where we're going. Um, is there anything else that you'd have to say as to what you see going for the future? And there's also a letter going around the country that's being passed off to Ottawa and the provinces, asking them to make a change. Do you have any
Is that the
comments on
COVID
that?
zero open letter or one of the other ones? I'm sure
Yes.
there's
Yeah.
more than one. Yeah. It's one like I've become kind of I guess have a unique niche for myself as an advocate because I've been working on climate for so long and creating change mostly successfully, and now working on COVID and creating change, and again arguably mostly successfully with the masks and some other things. um, but it gets tiring after a while, right? And so um, it can seem overwhelming, and I've heard this from some of my advocate colleagues, like we're fighting against what should be common sense. Like, we know where math goes, we know how to mitigate this, and people are refusing to do it, and it just seems exhausting after a while. But I recall when I did a stint in Nepal, and I was volunteering with an organization there on the weekend, something called Clean Up Nepal, and I remember showing up at this riverside park, and the idea was we were going to clean up this park. And you looked at this park, and it was just filled with garbage. Like, there's a lot of plastic pollution in Nepal, and people don't have any. They don't have any dumps, right? So the people just throw it out or they burn it. And so, looking at this, 2 acres of plastic garbage, I'm like, we'll never clean this up. Like, there's just no way. But there were 30 of us, and put your head down, and you just pick up one piece of garbage at a time. And over 2 hours, that place was spotless. Like, there was nothing left. And it was just because instead of looking at the big 2 acres of garbage, once you start focusing on one piece at a time, the issues become manageable. And it's quite a metaphor for dealing with climate change or this overwhelming COVID crisis, and that the problems seem big, but one battle at a time, get the job done, make partners, and work together, and it's amazing what you can do. So for me, the next big step is this panel discussion tomorrow, and I'm really hoping that maybe that little step of getting the WHO to acknowledge that airborne transmission is important and mitigatable will be one more little step that our crew has managed to push things forward. So if there's listeners out there that care about this and care about better policy, get involved. There's so much to do, and it's so fun and important. Maybe fun's not the word, but it's so meaningful to successfully enact better change and to know you were part of it. So
I think that's a good note to end on. So keep that in mind, everybody. Awesome. Thanks so much, Joe.
My soapbox.
Oh, actually, before we completely sign off, tell everybody where they can keep track of you.
Yeah, I'm mostly on Twitter now. I've kind of given up on Facebook. It's just too embarrassing and painful to be a part of that. But on Twitter, I'm at jvipondmd. So at jvipondmd. And that's probably the easiest place to follow my thoughts.
Cool. And you said you're also involved with Masks for Canada. Where can people hunt that down?
Maskforcanada.org. And if you happen to care about climate, I'm the co-chair of the Calgary Climate Hub and the president of the Canadian Association of Physicians for the Environment, which is a national organization. So, lots of fingers and lots of pies.
Awesome. More pies, the merrier.
So much shit to get done, man.
Yeah. Awesome. Well, thanks, Joe. Thanks for listening to this episode. The music you hear on this show is from the Jeff Lapp Trio out of Montreal. Find them at jefflapp.com. Shout out to Tara for doing the graphics for COVID On Air. A huge thanks to my editor, Jeff, at Bean Co. Studios in Regina, Saskatchewan. Please visit endcoronavirus.org for more information on ECV. Click on Join Us. Through that, you can volunteer with ECV, and you can subscribe to our newsletter, which is full of great information shot straight to your inbox from our delightful newsletter editor, Tracy. Also, please check out the blog at ECV, and hats off to Scott, our impeccable blog editor. You can find ECV on Facebook and Instagram and on Twitter at NCovid19. You can find me on Twitter at Mr. Farden. It's at MRFARDEN. Until next time.